Let's start off by you telling me your name, your date of birth, what year we're in, and where we are.
John Q, July 4th, 1987. It's currently 2022, and we're in Miami, Florida.
Perfect. So you are alert, you're oriented to person, place, and time. We're going to go into skin. So from what I can see, your hygiene looks really good. Your hair is nice and groomed. Your nails are intact. I don't see any rashes or lumps, any lesions anywhere. Your skin is appropriate for your ethnicity. Do you ever get any itchy or dryness? No? Any excessive sweating noted? Okay. And you haven't had any changes in your hair or nails?
No.
Okay. So your vital signs came out good. Your blood pressure was 120/80. Your heart rate 77. Respiration 16, which is normal. You're 6'2" and you weigh 208 pounds. So your BMI is within a healthy range. We're going to go into your head now. I am going to inspect your face. We did your cranial nerve assessment 1 through 12. It was a very long assessment and a previous assessment that we did. So I'm just going to kind of reflect on the results from that test as we're going along from head to toe. So we did cranial nerve number 5 and number 7, which is your trigeminal and your facial nerve. The trigeminal tests the facial sensation. So I did the light and dull touch with you. We did the temperature too. So you felt everything with that. It was intact bilaterally. You didn't have any numbness or tingling.
No.
Okay. And then for your facial nerve, we did the muscle strength. So you were symmetrical. I had you puff out your cheeks, smile, wrinkle your forehead. Everything was very symmetrical and normal on both sides. But I'm gonna go ahead and inspect your face, looking for any discharges or lesions or anything abnormal, and then also palpate and inspect your scalp. Okay. My flashlight stopped working, so I'm gonna use my phone.
No problem.
Okay. So. I'm gonna go ahead and feel around. You tell me if you feel any numbness or tingling, any pain when I do that.
Nope.
Okay. Let me go ahead and actually look at your eyes and inside your ears too. So just go ahead and look straight ahead. Inside your nose. If you could just turn your head this way. Perfect. So your skin eyesight is appropriate, the color's appropriate. I don't see any bumps or scarring, any lesions. I don't see any bugs or anything in your hair. And your facial hair is intact and well groomed. No deformities or scarring like that. Like, have you had any head traumas or injuries in the past?
No.
Good. So I did look at your eyes, and then the other assessment we also tested your cranial nerves 2, 3, 4, and 6, which is all about the eyes. We examined them as a group, and then with that I checked your visual fields and your visual acuity. So I was able to see with the 6 cardinal gazes how you can move your eyes in 6 different directions. So your visual acuity was 20/20 without any corrective lenses. Your eyelids look symmetrical and they're normal in appearance. You don't have any swelling or lesions. Your pupils are active and reactive to light, which is good. And then your movements are perfect, no shakiness or anything like that. Have you had ever any double vision, loss of vision, blurry vision?
No.
Nothing like that?
No.
Any pressure that you felt in your eyes?
No.
Perfect. So now we're gonna go moving on to ears, and I did inspect the inside of those. I don't have an otoscope to look into the eardrum or the tympanic membrane, but from what I can tell, you don't have any discharge coming out of your ears, which is a good sign. You keep them very clean, which is great. We also tested the cranial nerve vestibular function, which is your hearing function. And then that's when I did the whisper voice test, and I whispered in both sides of your ear with a different sequence of numbers and letters. And it came perfect bilaterally, so you don't have any trouble with that. Do you ever have any pressure in your ears, any like loss of hearing, any ringing in the ears ever?
No.
Okay.
I'll get water stuck in my ears in the shower, but that's it. On the beach or something, but that's it.
Okay. That's normal, yeah. So I did look inside your nose, and then we also tested the cranial nerve 1, which is the olfactory nerve and your sense of smell. And you were able to tell me that, or you distinguished vanilla from the other smells. So that was perfect. What I can tell is your nasal septum is midline, which is great. I didn't see any like inflammation inside your nose. The mucosa looks nice and pink and moist. I did not actually test for sinus tenderness, so I'm gonna go ahead and like feel around on your face and you tell me if you feel any pain. Any pain there?
Nope.
Okay. Feel here. Nothing in here?
Nope.
Okay. Have you had any loss of smell? I know with COVID going around, that was one of the symptoms. Any loss of taste either? Good. Okay, so we are going to go into the throat now. I'm going to inspect the inside of your mouth. On the other assessment, though, we did test your cranial nerves 9, 10, and 12, which is your gag reflex, which is intact. Your articulation of words are very good. You don't slur your speech. Your uvula, your tongue, the palate in your mouth, all the mucosa in there is nice and pink and moist. But I'm going to go ahead and assess it again because anything can change any day. So.
Okay.
So go ahead and open your mouth, stick out your tongue, say ah. Perfect. Move your tongue side to side for me. One side and the other. Good. Any pain with that?
Nope.
Good. Any recent, this flashlight doesn't turn off, sorry. Any recent surgeries in your mouth?
No.
All right, so we're gonna go into the neck now. I am going to have you sip a drink of water. When I tell you to, this is a brand new bottle. I just want to see how you swallow, if you have any swelling or any pain when you do that too. And I'm going to feel around for your carotid pulses, your lymph nodes, and your thyroid. All right. Yeah. So let me start with your pulses. Perfect. Your trachea is midline. Do you feel any pain as I feel around here?
No.
Good. Good. I'm gonna go ahead and palpate your lymph nodes now. I don't feel any swelling, but do you feel any pain when I do that?
No, nothing.
Any tenderness in your neck as I feel around here?
None.
Go ahead and take a sip of water for me, and I'm just gonna gently press on your esophagus just to feel as you swallow. Good. Okay. That's good. Or take another sip if you like. I also want to assess your neck strength. We're gonna assess the spinal accessory nerve. I'm gonna press down on your shoulders and you try to elevate them up.
Okay.
Good. Okay, I'm just gonna feel around now. Can you bend your head forward for me? Any pain in your spinal column as I feel along?
No.
No? And back here? No pain?
No.
Good. All right. Perfect. So in the other assessment, we also did your motor, your sensory, and your reflexes, which everything came back great. You have good muscle tone. You have no motor deficits. We did the walk test as you went back and forth on your heels and your toes. So your coordination and your gait were good. You don't use any assistive devices, do you?
No.
Perfect. So your strength also was good bilaterally, 5 out of 5, which is how we rate it. We did your deltoids, your biceps, your triceps, your quads and your hamstrings, how you move them against gravity, and then also with resistance. So everything was perfect. Your sensation was intact bilaterally to pain, the temperature, and the light sensation or stimulation that I did with a Q-tip on both ends, and the 2-point discrimination between soft and sharp. And then your reflexes were good too. No involuntary movements from what I can see, no tremors. Your Babinski on your foot when I grazed on the back was perfect, so no spinal deficits in that sense. So in the next part, we're gonna move on to your heart, your lungs, and your abdomen.